Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith Rogers. Today, the federal court case on vaccine policy. I speak with Sarah Despres, an expert in immunization policy, about the details of the case and its immediate impacts on vaccine policy, innovation, and public opinion. We also talk about the potentially larger meaning of the decision on HHS Secretary Robert F. Kennedy Jr.'s approach to vaccine policy. Let's listen. Sarah Despres, thank you so much for joining us again on Public Health on Call. How are you?
Good, thanks. How are you?
I'm great. Today, we're going to talk to you about the federal court case involving vaccine policy. But before we get to that, would you just give us a brief intro of you and your work?
Yeah, sure. Happy to. I'm a lawyer by training. I spent about 13 years on Capitol Hill working on the Senate side and mostly on the House side on the Energy and Commerce Committee and the House Oversight Committee, focused primarily on public health, including vaccine policy. I then went to the Pew Charitable Trust, where I ran the government relations division for their public health portfolio, and then joined the Biden administration on day 2 or day 3 of the administration, and was there serving as a counselor to Secretary Becerra on public health for 4 years. And I'm currently a consultant working for several nonprofits, focused primarily on immunization issues.
So describe this court case to us. What happened here? What was the decision?
Yeah, so the American Academy of Pediatrics and a number of other public health and professional groups and professional societies sued HHS regarding the decisions that Secretary Kennedy had made changing immunization recommendations. And so, without getting too into the weeds of the court case, the case alleged that Secretary Kennedy was violating the Administrative Procedures Act, which is the law that ensures that agency actions are not arbitrary and capricious, as well as the Federal Advisory Committee Act, which is the act that is designed to ensure that federal advisory committees have balance and are not stacked in order to achieve a preordained outcome. This was in response first to the changes to the COVID vaccine recommendations last year, and then to the wholesale change that Secretary Kennedy made to the entire childhood schedule earlier this year in January. And a court found that AAP and the plaintiffs were likely to prevail on both of those claims, the Administrative Procedure Act claims and the Federal Advisory Committee Act claims. And as a result, put an injunction on the implementation of the new schedule, basically putting us back to where we were in January 2025 with regards to vaccine recommendations. And he also essentially said there are no current members of the Advisory Committee on Immunization Practices.
So what is sort of the immediate impact of this decision?
Well, immediate impact is confusion and chaos. So where we are is we are back to the recommendations that existed in January 2025. There are some open questions about liability protection for pharmacists, for example, who administer COVID vaccines, because currently, there isn't actually a COVID vaccine recommendation, and it doesn't look like there's going to be one for the next year, which throws some of the liability protection issues specifically for pharmacists into confusion. And also, I think there's confusion around what this means for insurance coverage, which is important for access. That said, the insurers have been very clear that they will continue to cover all of the vaccines that were covered, as of January 2025. So in reality, vaccine access continues to be assured, at least vis-a-vis insurance coverage. But I do think that this has caused a tremendous amount of confusion and chaos out there in the real world.
Do we know also how this is playing out, like in doctors' offices? I know there was a lot of confusion about now they're going back to the original recommendation schedule. Some of those vaccines were no longer recommended, so now they are. What are doctors following now?
Yeah, well, so what has happened is, given the chaos and confusion around ACIP and the CDC/Secretary Kennedy recommendations predating this court case and predating actually the decision that came out a couple weeks ago, the professional societies have really stepped up and have reinforced their own recommendations. So the Academy of Pediatrics has its recommendations that came out last year. The American College of Obstetrics and Gynecologists, the American College of Physicians, Infectious Diseases Society. So together, the professional societies have recommendations that their members are following, and the professional societies have been doing really important outreach to their members to know, like, whatever you're reading in the news, whatever you're hearing about what's happening at CDC, these are our science-based recommendations that actually are consistent with where things were in January 2025. But, it's easy to imagine that with all the chaos and confusion, providers may continue to be confused, but also they're dealing with patients who, parents who really don't know what's going on. And I think one thing that we know when it comes to public health and public health recommendations is that confusion is the enemy. It's okay to have evolving science. That's typical, and it's important to acknowledge that. But whiplash without a really well-developed sort of rollout plan that explains the decisions will only actually breed mistrust and can really harm efforts to make sure that parents understand what the science is and, what is the best decision for their kids. So I'm really concerned about that level of confusion, even though I am not concerned that insurers won't cover these vaccines, for example. I think the confusion is the key here.
Yeah, we can't go back to before this all happened and erase the last, year or so from everybody's memory. So do we just not have an ACIP right now?
We don't have an ACIP right now. Yeah. I mean, and the administration has until mid-May to appeal. So there's an open question about whether they will appeal. I think it gives them a couple of options. One is they could appeal. The other is they could try and do CDC recommendations without input of ACIP, or they could try to put together a new ACIP. But in both those cases, they have to make sure that they follow the Administrative Procedures Act, and if they're trying to put together a new ACIP, the Federal Advisory Committee Act. Otherwise, they'll be open to legal challenge. So, I mean, I think that they are in a bit of a hard spot, but, the simple fact is we likely will need CDC recommendations for the upcoming respiratory virus season in order to, ensure insurance coverage for COVID and flu vaccines, because those are annual recommendations. Others, like measles, just continues throughout the ages unless science changes. But the COVID and flu vaccine recommendations are updated every year to reflect, the new strains and the new vaccines that come out.
And I know because of this decision, there was at least one meeting that had to be canceled. And I'm just thinking back to a year ago when there were delays and cancellations. Is that's now again the concern?
Yeah, I mean, I think, what the judge said is, while it was beyond the scope of his authority to require the meeting to be canceled, he did say there weren't any ACIP members. And so, if there are no ACIP members, it's hard to imagine a meeting. So I don't know. The administration will have to make a decision about what they're going to do, or they go forward with a new ACIP or without ACIP, but somehow meeting the requirements of the Administrative Procedures Act. And I think putting together a new ACIP is no easy feat. I mean, I think you've got to, particularly since there are no members now, traditionally, members serve 4-year terms. And so you have like a rotating cycle. You never have all 17 or whatever the number is, members leave at once. Usually you're looking to fill 4 or 5 spots a year. And so they're going to have to, if they do want to go for a new ACIP, they're going to have to find willing members who meet the requirements and then do the vetting, which is not an insubstantial process. And so the question is, are they able, if that's the route they choose to go, are they able to do that in a way that meets the FACA requirements in time to make recommendations for the respiratory virus season. The other thing that's kind of interesting that isn't getting enough play, I think, is the effect of this chaos on vaccine innovation. There's been some press around a Moderna mRNA flu vaccine, which originally FDA refused to accept, and now FDA has accepted, and that vaccine at some point, if it is approved in a pre-Secretary Kennedy world, ACIP would have had a working group to be evaluating the data so that when that vaccine is actually approved, if it's approved, ACIP can make a decision about how to recommend it, fairly close to the approval date, so it's not out there languishing. And so, there's an open question about what happens with that vaccine. And there's a Lyme vaccine that Pfizer is developing. We've seen some press around the pivotal trial that was published a couple weeks ago. There looks to be efficacy, though there's some questions around the clinical trials. So, I'm certainly not going to preordain the outcome here. But if that vaccine were to be approved without an ACIP, how are they going to make a recommendation? And that's another one where there traditionally would have been a working group looking at all the data in advance of the approval under NDAs and, having access to data that's not public, so that if the vaccine is approved, it's not languishing out there without a recommendation for a long time. So I think there are a lot of open questions, both about how providers and the public are seeing the current recommendations, given the whiplash, but also what this could mean for future vaccines and for investment in future vaccines. Without a functional ACIP, I think the implications could be quite significant.
And this is, I'm not a lawyer. This is one of the outstanding questions I had in my mind was the judge set the recommendations back, set the clock back. He did not set the clock back on ACIP. Like, it didn't reinstate the previous committee. Is there a world where that committee comes back together?
I don't know. I mean, it seems hard to imagine that the current HHS would actually reinstate those members. So again, it feels like in the current moment, anything is possible. But I think if they are going to go a new ACIP route, my guess is, and this is really just a guess, that they look for new members and not bring back all of those old members. So the members many of them have been quite vocal about their willingness to serve again, and they've been serving, quite honorably in an uncompensated way for a number of years. And they've really done a public service. But I think it is unlikely that they just reinstate that same committee.
So we've talked about the impacts of the decision, in the real world and how this is kind of playing out. But it felt like the court decision was a statement on something, or maybe a sign of the zeitgeist. Can you talk a little bit about the symbolic meaning here?
Yeah, sure. I mean, I think you're probably seeing a lot of press about how the White House is less interested in having the focus be on vaccines, more interested on the focus being on other parts of Secretary Kennedy's agenda that may have a larger political constituency. For example, the interest in, healthy foods. And I think symbolically, this decision puts them in a bit of a bind, because anything that they do will get a lot of attention and will maybe harm their efforts, because the reality is that, parents want to be able to immunize their children. They want to be able to make those decisions to keep their kids safe. And the assault on vaccines is politically quite unpopular. And you're seeing, when they announced I think it was January 5th, new schedule, there was a lot of talk from administration leaders, particularly, Secretary Kennedy and Dr. Bhattacharya and Dr. Bhattacharya even testified to this. The goal of this new schedule is actually to improve confidence in the schedule. Well, the polling that's come out in the last couple of weeks demonstrates that that's actually not happening, right? Like, the public is not more confident in this immunization schedule and is increasingly less confident in HHS leadership on issues relating to immunization. And so I think what we're seeing is a public that is just really not interested in this assault on protecting their kids against infectious disease. And, I think that this is another sort of example, this judge of checks and balances in the system, right? You've got the political checks that are that are happening may happen at the ballot box that you're seeing in the state legislatures. And then you've got the judicial checks. Like Secretary Kennedy can't just remake everything in his own image. He needs to actually follow these laws that sound really boring, the Administrative Procedure Act and Federal Advisory Committee Act, but these very process-oriented laws are the laws that are designed to ensure that the decisions that agencies make are rooted in evidence and science and are not left to the capriciousness or the whimsy of one political leader. So I think you are seeing some kinds of pushback, both politically and from the judicial branch, against some of the stuff that I think could be argued is arbitrary and capricious.
So you've said that they will have a chance to appeal. Is that what you're looking for next?
Yeah, I mean, I think, we'll see what happens in mid-May. If they don't appeal, then it'll be really interesting to see. I mean, whether they're, actually quietly trying to reach out to potential ACIP members already. I mean, for all we know, that could be happening. I haven't heard of it happening, but it doesn't mean it isn't. Or maybe, they'll appeal. They'll put in the appeal at midnight on May 15th or whatever the date is. Yeah, so we'll certainly be watching for that. One thing I will say on the ACIP membership is traditionally there has been a sort of year-long kind of continuous call for nominations that's been quite public. And we haven't seen that. We haven't seen that from this administration at all. We certainly haven't seen it happen in the last 2 weeks since the judge's ruling comes out. So one thing I would be looking for is whether there is any kind of public call for nomination for ACIP. And, if so, that suggests maybe they are going to try and recruit members and do it in a way that passes the requirements of FACA.
Well, Sarah Despres, this has been a really helpful conversation to put everything in context. Thank you so much.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.